Cloud services for healthcare organizations comes with many benefits today. Cloud services has evolved quite a bit since it was introduced many years ago. And what we're seeing today is that there's a lot of agility that comes with cloud services that allows a healthcare organization to easily be able to provision applications quicker. And what that means is that typically in a cloud service offering, the infrastructure is already there and available. And what's being made available for the healthcare provider is the resources of that infrastructure so that it can support something like an application that they're moving into that cloud. And then what that means is that the healthcare provider doesn't really have to then invest into the hardware or software technology from a capital perspective because it may already exist. And then they don't have the capital expense, and then what they would look at is then utilizing that service as an operational expense. Some of the key factors that healthcare providers really need to look at when they're starting to consider utilizing the cloud services is that they got to understand really, first of all, what their requirements are that can match some of the services that are being offered out of the cloud. Then they also have to take into consideration, too, and ask themselves, is it secured? Is the cloud service also going to perform? Is it going to be available to me when I need it? Because when they determine what type of applications they want to move to the cloud, they're going to really need to understand that if they have that application currently on-premise, moving it to off-premise into the cloud, they're going to require meeting the same types of service levels that they currently have today. So security, performance, availability are really, really key. And anytime that they talk to a cloud service provider, those are the questions that they really need to understand and get answers to. And by understanding and getting answers to that, you also will have a better understanding to help you determine your total cost of ownership and your return on investment when and if you use cloud services. Healthcare service providers in moving to the cloud really need to understand what their requirements are that they're looking to move to the cloud. My recommendation would be is to work with a very experienced IT service provider such as CareTech, who understands the healthcare industry, understands the IT infrastructure, so that they can work with the healthcare service provider in determining what applications can be moved to the cloud, such that then they can develop together a roadmap, a cloud roadmap that would make sense and would be much more successful because of the planning that is really required to move applications successfully to a cloud service.